Let's be honest, choosing a new dentist can feel like a total shot in the dark. You cross your fingers and hope for the best, but how do you actually know you're in good hands? Well, if you're in Taiwan, that whole guessing game is about to change in a big way, so let's get into it. Right? This is the question that's always in the back of our minds. I mean, sure, the office might look nice and the staff seems friendly, but what about the stuff that really matters? What are the real signs of excellent, safe, top-quality care? How can you be sure? Well, here's your answer. Take a look at this. It's a new official seal of quality. This little logo, brought to you by Taiwan's Ministry of Health and Welfare, is designed to do one thing: take all the guesswork out of finding a fantastic dental clinic. Okay, so what exactly is this thing? What's behind this new seal of quality? Let's break it down. The official name is the Dental Clinic Medical Quality Certification. And really, it's a pilot program with a super simple mission: to find and give a shout out to the dental clinics that are going above and beyond the basic standards to provide absolutely top-tier care. Now, the key word here is certification, and this is so important. It isn't some mandate from on high. It's a totally voluntary process. Clinics have to choose to invite these external experts in, and these folks don't just show up with a clipboard to judge them. They actually guide the clinic, helping them level up their services and, the most important thing of all, patient safety. You might be wondering, though, why is this happening now? What's the big deal about certifying dental clinics all of a sudden? Well, the answer really comes down to the sheer scale of modern dentistry. Get a load of this number. Over 80%. More than 80% of all dentists in Taiwan work in local clinics, not in some giant hospital. Think about that. It means your neighborhood dentist, they're the absolute backbone of the entire country's oral health. And right there, that's the big challenge. When you have thousands and thousands of independent clinics, all doing things their own way, how on earth do you make sure that every single patient, no matter where they live, gets that same high standard of care? That is the exact problem this certification is trying to solve. Now, we need to make a really key distinction here, because it's easy to get the wrong idea. This program is not just another stressful test for dentists to pass. Yeah, forget everything you know about a pop quiz or a surprise final exam. That's not what this is. A much better way to think about it is like signing up for an elite coaching program. Clinics want to be a part of this. They're raising their hand to get expert guidance so they can up their game. And that makes this certification program fundamentally different from the mandatory evaluations that big hospitals have to go through. Look, the hospital evaluations are mandatory. They're based on the law and tied to insurance money. It's a stick. But this new dental certification, it's a voluntary carrot. It's all about quality improvement and earning that seal of approval. It's a choice to be better. So what happens when a clinic actually signs up for this? What does the process look like? All right, let's pull back the curtain and take a look inside the quality check. The process itself is pretty straightforward. First, a clinic puts in an application. Then, the local health bureau makes sure they're eligible. After that, the Joint Commission of Taiwan, or JCT, schedules the big event, a super thorough on-site review that takes about 2.5 to 3 hours. And based on what they find, they make the final call on certification. During that on-site visit, the reviewers are really zoning in on 3 main pillars. First up is business management, basically how the clinic is run. Second is dental clinical care services, the actual dental work. And third is quality improvement, how the clinic is constantly learning and getting better. So for that first pillar, business management, they're looking at all the foundational stuff. We're talking about everything from making sure fire safety is up to snuff, to verifying that all the staff have the right qualifications, and of course, making sure your personal patient data is being kept private and secure. It's all about creating a safe, professional space. And just to give you a feel for how deep they go, especially on the clinical side, check out this guideline. It says, the clinic must have procedures for instrument cleaning and sterilization with records maintained. See that last part? It's not enough to just say you clean your tools. You have to prove it with a detailed paper trail for everything. And the checklist goes on. They're also verifying how controlled drugs like anesthetics are managed, making sure your medical records are super detailed and accurate, checking that there's a rock-solid plan in case of a medical emergency, and confirming you're giving clear, informed consent before anything happens. All absolutely critical stuff. So when you put this all together, what does it really mean for the future of going to the dentist, both for you, the patient, and for the dentists themselves? Well, this whole program sets up a really interesting dynamic. There's a ton of value here for patients, for sure, but it also presents some pretty real challenges for the clinics that want to get on board. For us as patients, the upside is huge. You get more trust, more transparency, and a super easy way to spot a high-quality clinic. It's peace of mind. But on the flip side, for the clinics, this is a heavy lift. We're talking about increased costs for equipment upgrades or new training, plus a mountain of administrative work and paperwork. It's a serious commitment. And it's really important to remember this is still a pilot program. Think of it as a bold first step. The results from this are definitely going to shape the entire conversation around dental standards for years to come, probably setting a whole new benchmark for the industry. Which, of course, leaves us with one last big question to chew on. We're talking about quality standards today, but with technology and AI changing healthcare so fast, what will we even consider a quality visit 10 or even 20 years from now? What will that future look like? Definitely something to think about.